Hi, my name is Dr. Jon Repole over at Jacksonville Health and Wellness Center, and today's segment we're talking about cardiovascular disease, the #1 killer in the United States. And this one, as I'm talking about it, hits near and dear to my heart because as I was speaking today, I had a friend, a close friend, who died of a heart attack. So I want to talk a little bit about some of the myths that surround cardiovascular disease. So first things first, we go to the doctor's office and they run some blood work testing and they're really focusing and concentrating on the lipid panel. They're looking at the total cholesterol, the LDL cholesterol, which is the bad cholesterol, and the HDL cholesterol, which is the good cholesterol. They look at and compare them to the reference ranges, and then they make a determination on whether or not they need the antidote. And of course, the antidote in the conventional mindset is going to be what? It's going to be a statin medication that they need to take. All right, well, that's not good enough because the #1 sign and symptom of heart disease is oftentimes a heart attack, right? Because you can leave the doctor's office with a clean bill of health, good blood work. So there's other factors that are being overlooked. So when we look at high blood pressure, when we look at high cholesterol, we need to understand that these are not diseases. These are symptoms. These are the way that the body in its infinite wisdom is trying to control the processes that are going on inside the body. We need to support, not suppress them, right? So, it's analogous to the reason why somebody's temperature is raising when they're sick is to boil off or to burn off that bacteria. Right? We don't want to suppress the temperature. Of course, it can get too high, we need to intervene, but in 90% of the cases, right, when the temperature is rising up, it's doing it because the body knows what it's supposed to be doing. In the same way, the blood pressure is raising up, it's a warning sign. It's a signal to tell you that we need to explore and look a little bit deeper. So we need to understand the mechanisms or the events that occur that lead to cardiovascular disease. So it's called endothelial disease. We have this one cell thick layer that surrounds the cardiovascular wall. And because it's one cell thick, it's very susceptible and very prone to injury. And that is the first step in cardiovascular disease. There is an injury and an upset to the endothelial lining, and then the body begins this repair process. And the repair process is a signaling mechanism to bring components into the area to plug it up. So it will migrate smooth muscle to the area. And of course, as everyone knows, it will migrate cholesterol, which acts as the fibrous cap in order to help heal the area. That's what the cholesterol is doing, right? So after that happens, we get this plaque formation. We refer to that as arteriosclerosis. So we need ways to identify not only the plaquing, but the insults that initially started, because that's the silent disease. And that has a lot to do with the inflammatory component. So we need to expand our blood work panels to include the inflammatory components whenever we're running or whenever we're looking at cardiovascular disease in general, and we're really serious about it. Because it is the #1 killer in the United States, we need to have some of these testing, like as an example, C-reactive protein, which tells us our inflammatory load, run as a general blood test on every person, so we get a better assessment and not just looking and getting caught up in the lipid panel. So once we identify certain inflammatory markers, say in the blood work and those types of things, then we start to do the intervention through diet and lifestyle. Cardiovascular disease can be prevented and reversed by change to your diet. And it's extremely important. Not all cases, of course, of cardiovascular disease, but most can be helped by changing the diet and lifestyle. Cardiovascular disease is a degenerative disease. By definition, that means it's a disease that's caused by diet and lifestyle. So the antidote must lie within diet and lifestyle. Other things that we need to be looking at as far as the insults to the endothelial lining would be, of course, poor oxygenation, would be sedentary lifestyle, would be the toxins that we're breathing in that we are able to control in our home environment, in our work environment. The number one cause where we're getting most of the insults to our endothelial lining comes from animal-based products. And that's because they have a double dose of deleterious effects. Number one, they contain microorganisms million to billion-fold increase than, say, a plant-based meal. So we have all of these bugs that when we eat a piece of dead flesh that go into our body, then go into our bloodstream and start attacking the endothelial lining. And of course, cholesterol is only found in animal products, and animal products, of course, have the antidote to the inflammatory response, which is the fibrous cap or the cholesterol, which then it lays down, right? Because there's no cholesterol in a piece of fruit, no cholesterol in a piece of vegetable or a bean or a nut or a seed and so forth. You only find cholesterol in animal-based products. And again, that's not the only issue, right, with cardiovascular disease, because our body makes cholesterol well. So we're not saying that cholesterol is evil in any sense, because our body needs cholesterol. Cholesterol is a vital component of our cell walls and so forth, hormonal communication. It's always the Goldilocks rule, right? So a high ingestion of animal products is going to create the environment for inflammation, as well as give the necessary tools to put the cap on, which is the cholesterol as well. So anybody who's serious about cardiovascular disease really needs to be looking at their diet and focusing on a plant-based nutrition or whole food diet of plant-based foods. And the other component that I just wanted to touch on here, because it's one of those things that people, sometimes there's a myth surrounding saturated fat. So we know that saturated fat, primarily in the form that comes from animal products, which are what we call long chain fatty acids, are deleterious and negative to cardiovascular disease. Now, coconuts have saturated fat, but we need to distinguish the two, because coconuts have what they call medium chain fatty acids, which actually have a positive effect on cardiovascular disease. It's just the opposite. The correlations there is that high amounts of medium chain saturated fats have a decreased rate or risk of cardiovascular disease. But just the opposite is true with saturated fats. And there's a whole mechanism of how the fat accumulation goes into the cell and creates issues with insulin signaling and so forth, and it has a lot to do with the types of saturated fat. So we need to distinguish between animal saturated fat and plant-based saturated fat. I invite you to come to one of our free lectures as we'll explore this topic in more detail, and then of course talk about all of the diagnostic parameters and testing that you can do, as well as what you can do for yourself and for all of your loved ones in order to kind of get control and autonomy back over your body and your health. Thanks so much for listening.